Hello, this is Dr. Stanley Lang, and welcome to this broadcast. This is a continuation of a series on how to use a whole health approach to control or to reverse diabetes. And the model that I've been showing is this little diagram which shows the integration between body, mind, and spirit, and what I believe is the most true path to health and wellness. And today I'm focusing on the physical part of that triangle and focusing in particular on the role of exercise in reversing or controlling diabetes. Last week I talked about the role of cardiovascular exercise, talked about the two different main varieties, one being aerobic, the other being more of an interval training program. Today I'd like to focus on the role of strength training and how that helps to control diabetes. Now, most diabetics are what we call type 2 diabetics. That means that they have developed a diabetes that is not insulin deficient. In fact, in most cases, they have way too much insulin compared to the normal person. But what they have developed is a lot of insulin resistance. So part of the treatment is to try to reverse this insulin resistance. So one idea of an idea or an image that helps you to understand what insulin resistance is. Insulin is a hormone that basically causes the cell to open up and let sugar into the cell. So without that process, the sugar stays outside of the cell that needs that sugar for fuel. And so we can imagine that insulin is like a key, and the insulin receptor that the key plugs into, that the insulin plugs into, is like a keyhole in a door. Now, under most circumstances, when the body is working correctly, it's like you put a key into the lock on your door, and everything is nicely lubricated. You turn the key easily, the door opens easily. There's no problem at all. However, with insulin resistance, it's like somebody snuck in first and stuck some goop into the keyhole. So you can put the key in, but you try to turn the key and there's just a lot of resistance. You might be able to eventually turn the key and open the door, but it's much more resistance because that goop is in there. And that's essentially what's happened with type 2 diabetics with insulin resistance. Now the question is, what can you do to decrease this insulin resistance? Well, there's several things that you can do. Some of the medications out there help decrease insulin resistance a little bit. At least that's the theory on how they work. There's a lot of nutrients that can help decrease insulin resistance. But one of the most powerful things that decreases insulin resistance is cardiovascular exercise, which affects the existing insulin receptors. But another thing that decreases insulin resistance is building more keyholes, putting more keyholes there for you to plug the key into. In other words, building more insulin receptors. Now, the exercise program that I talked about last week, using the interval training where you hit maximum exercise, you're doing what we call anaerobic exercise, actually creates a kind of muscle that has the most robust insulin receptors on it. It's the most insulin sensitive muscle in the body when you exercise your body that way. But strength training is an alternative way to build this kind of muscle, depending on how you do the strength training. Now, a lot of people are afraid of strength training because it just seems like it's complicated, or they need to have a lot of fancy equipment. And the neat thing about strength training is that you can do 5 or 6 really key, really core exercises that build strength that you don't need any equipment for at all. In fact, I've got some videos that show you how to do these 5 or 6 key bits of these 5 or 6 key strength training programs or strength training exercises with no equipment at all except a couple of chairs or a tree or something like that. And very simple to do these, and if you do them 3 or 4 times a week, you will build significant muscle mass, and you'll build insulin receptors to go along with that muscle mass. Therefore, you're creating a lot more insulin receptors that the insulin can integrate with, and it decreases the insulin resistance. And the diabetes control dramatically improves. So getting into a good and safe strength training program is something that you need to do if you want to help to control your diabetes. Now, everybody needs a strength program anyway. This isn't like diabetics have to suffer because they're diabetic. They need to do the strength program, because especially as people get older, we need to do strength training on a real regular basis. In fact, some researchers believe that above age 60, strength training is more important for wellness and health than cardiovascular exercise like aerobic exercise. So I encourage you to get into a good strength training program. There are a lot of bad ones, and there's a few good ones. And this video is a little bit short to get into the details, but in the summary video later this week, we could perhaps dig into this a little bit more deeply. So I encourage you to do this. It's doable by virtually anybody that can move. I wish you well, God bless, and have a great day.